Today we'll be looking at male body image. Many people stereotypically associate body image issues with women and girls. Whilst it is true that the majority of people who suffer from eating disorders are female, men suffer from these illnesses too. For example, it's estimated that between 5 to 15% of people suffering from anorexia or bulimia are male. Also, it's thought that men make up 35% of patients with binge eating disorder. Even though these numbers are already significant, the figures in reality are probably much higher. Boys and men may be less likely to report their issues with body image and eating, and they can be less likely to be diagnosed as having these illnesses because the issues are typically seen as female issues. What kind of body image issues do men and boys face? Just like girls and women, boys and men experience emotional, physical and behavioural symptoms of eating disorders. They have a distorted sense of their body and its proportions. In boys and men, this can often take the form of muscle dysphoria. This is a concern over the size of a person's muscles and a desire to be more muscular. Some boys might fixate on this desire and take steroids and other harmful drugs in order to bulk up or achieve a more muscular physique. On the other hand, some boys might fixate on the idea of losing weight for a particular reason. Often, this can be because of being bullied about their size, or because they play a sport which requires them to be a certain size. For example, runners tend to be lean, whereas weightlifters tend to be bulkier. Men and boys are also subjected to pressures around their appearance. Much like for women and girls, there is a lot of pressure to conform to the so-called ideal image presented in the media. In adverts, magazines, TV shows, social media, men are often presented as chiseled, muscular and toned, and this can cause a lot of anxiety and dissatisfaction for men who just don't match that particular body type. As one activist put it, it's just as hard to be Ken as it is to be Barbie. When are boys and men more likely to get eating disorders? Eating disorders can affect men and boys at any age. However, the most common age for an eating disorder to occur in males is between age 14 to 25. Eating disorders tend to be used as coping strategies for dealing with difficult circumstances. This could be situations in life that are hard to cope with, or emotions which feel out of control. Because our society tends to discourage boys and men from expressing their emotions, this may make them more susceptible to eating disorders, especially during adolescence, early adulthood, or midlife stages. These are all times of life when emotions can feel out of control and when there's often lots of change going on. Are there any particular types of men who get eating disorders? It's very difficult to get a clear picture of how many boys and men are affected by eating disorders and body image issues, so it's hard to make any generalisations. There is some evidence to suggest that being gay or bisexual can be an increased risk factor for eating disorders in men, but this doesn't mean that all gay or bisexual men will have an eating disorder, and it doesn't mean that all men who have eating disorders are gay or bisexual either. There are several reasons why gay or bisexual men are thought to be more at risk. Gay male culture can sometimes place high importance on physical appearance. Gay and bisexual men may be more likely to seek help. What can be done to address the issues that men and boys face around body image? A recent survey of boys and young men in the UK found that the biggest source of pressure was friends and social media. The problem for boys and men specifically is that their friendship groups often involve a lot of banter. This means that sometimes hurtful things might be said, but the expectation is just to laugh off any hurtful comments and go along with the joke. Male friendship groups do not always encourage the expression of true feelings, and admitting that you're hurt can be seen as a sign of weakness. Changing this attitude could help tackle issues of male body image. Other areas identified as helpful in fighting the problem include 1. Increasing the amount of education for boys, their parents and teachers about how to identify different types of body issues and disorders. 2. More campaigning to raise awareness of how airbrushing is used in advertising and how many images of males in the media are digitally enhanced. 3. More diversity in the media, having males of different body types in adverts and on TV being portrayed in a positive light. Thanks for watching. Don't forget to subscribe for more PSHE videos added weekly.